Next 14 days, cases have increased 11% throughout the United States, and we now have a 7-day rolling average of 24 new cases per 100,000 people. Arizona has seen a 40% increase in new cases over that same period, with a 49 daily new cases per 100,000. So in Arizona, compared to the rest of the country, we're almost twice as high in new cases. Hospitalization rates have increased in Pima County as well, which is a cause of particular concern. I know that we all want to put this pandemic behind us, but we're definitely not out of the woods yet. If we do not do the right things, the cost could be enormous. This community has demonstrated that we know how to take care of one another and how to be good neighbors. And I'm asking you all to please keep it up. The best thing we can do is to continue basic public health practices that we all know well. Cover your face continuously in public. Keep socially distant. Wash your hands and get vaccinated. It seems that we've been saying that for now nearly 2 years, and we must bear down and keep on this mission. The Pfizer vaccine is now available nationwide for 5 to 11-year-olds, and as of Wednesday, nearly 1 million first doses have been administered for this age group. This is a promising beginning, and I believe an encouraging sign for all of us. If you have yet to receive your vaccination, please consider making an appointment today. Students and employees can make appointments by visiting the Campus Health vaccine page on this slide. Additional locations can be found at vaccines.gov. As a reminder, university employees must provide documentation of vaccination to comply with guidelines for federal contractors. There are 3 ways to meet this requirement. Upload your document via the university's HIPAA compliant system, which is secure and maintains privacy. Secondly, if you have received your vaccine in Arizona, you can verify your vaccination status through the state immunization information system. And lastly, your vaccine document can be verified in person at the Student Union Memorial Center in the Tucson room. Hours are Monday through Friday, 7:30 a.m. to 3 p.m. If you wish to request an accommodation, there are 2 pathways. For disability or medical accommodations, visit the DRC page on the slide. For religious accommodations, visit the HR page on the slide. Whether you're vaccinated or not, I strongly encourage you to continue to test regularly. The university offers both rapid antigen and saline gargle PCR tests at no cost to students or employees. Tests are also available at several community locations, including many pharmacies. Testing will be incredibly important as we begin this holiday travel season. If you want to get a test through the university, please note that there will be some changes in hours of operations for the days leading up to the holiday break. The testing locations webpage has the latest information and will be updated with schedule changes. For our students, I strongly encourage you to get a test prior to leaving for the long holiday weekend, for your well-being and that of your families and the people that you love. Finally, I want to thank the Dean of Students and Vice Provost for Campus Life, Kendall Washington White, for being here to talk about the importance of self-care and mental health. As I've said many times before, the pandemic has taken a toll on every single one of us. Obviously, some more, some less, but everyone's life has been changed significantly. Please know that the university has resources to help everyone, no matter who you are, that we care intensely about each one of you, and we want you to be well. please reach out if you need help. We're here to help you, especially during this holiday time and during the stress of finals. So with that, I'll turn it over to Dr. Carmona. Thank you.
Good morning, all. Thank you, Bobby. And appreciate the opportunity to connect with our community once again on so many important issues today. First and foremost, before I bring up the slides, just to make a couple of comments. As you alluded to, the COVID case rates are increasing significantly. This is something I think we spoke about previously to warn everybody as snowbirds come in, as the weather is cold, as people start staying together closer, that we would expect that there may be some bumps. In our United States, we've had 784,000 deaths. We've had 48 million infections. In Arizona, as we look at our numbers here, we keep bumping up. Most important that isn't in the data that we speak about every week is that the COVID exhaustion of our staff. Our nurses, our nursing staff are being decimated. Our technicians, our respiratory therapists, our physicians, they have been in combat for almost 2 years now with an invisible foe. Think about not being able to go home and hug your kids until you shower and dispose of your clothes that you were wearing during the day. Think about the stresses that this has brought on. But yet our university community has risen up and handled this very well. But I want people to remember how important it is that our frontline folks who are in harm's way every single day continue to do this. And now as we come into the holidays, we're seeing that we are still short-staffed. Some days we don't have enough beds. And we all know at this time of the year when snowbirds come in, even when everybody's healthy, we still have a flu season, and we have seniors who get sick. We have a senior who falls. We don't have the ability to surge as we did in the past pre-COVID because those beds are now filled with COVID patients. So to the president's comments early on, we're not out of this yet. We are still in the midst of a pandemic that has hurt us physically, emotionally, economically, and we have to bear down because if we don't, this will be prolonged. So let me have the first slide, please. So if we look at the rolling averages, again, these are numbers that I think you're all familiar with, that we've been using every one of our conferences with you to just give you an idea of the trends. And the trends in Pima County are not where we'd like them to be. They're bumping up. In the state of Arizona, they're bumping up. In fact, the Southwest as a whole is bumping up in the wrong direction. So at Arizona, you see we're 13th highest in the nation with 48. The national average is 24, so we're twice that. Minnesota, getting real cold there. People are coming in and closer, and you see they're at 67. California doing relatively well. Pima County and Arizona about the same, and Maricopa about the same as well. So these numbers, you know, don't look at them just fixed, but what they're telling us is we're trending in the wrong direction. That's the important message here as we look at this data conference to conference with you. Next, please. And if we look at the testing results, you know, we've always said at our bar was that to stay below 5%, 2.4, 2.0, 1.5. When we look at our testing window of the 1.5 with 828 positive over about 54,000 tests, it's not bad, but we were even lower before. So you're seeing these slow upticks. And the president gets an incident summary every 24 hours, where not only he sees these numbers, but he also knows how many beds are in our community and at the state, how many beds available that is, how many ventilators are available. But again, it doesn't tell us the staffing. We know that internally, the staffing is stressed. And again, being in combat, the equivalent of combat for almost 2 years, it is really tough to sustain this op tempo with this disease. Again, we have to use all those tools that are in our toolbox, the mitigation strategies, vaccination, because the more we can get to herd immunity, the less places that virus has to go to circulate, and it'll start to go away. Not really leave, but it won't have any place to go to be able to replicate in somebody's body when we reach that herd immunity. So it's very, very important we don't forget that. We're still in the midst of this pandemic. It is an extraordinarily challenging, difficult time, both for mental, physical health and the economic catastrophes it is causing. Yet vaccine remains probably the most important tool we have today to return our economy to normal, to return our university to normal, and be able to really move into what that new normal will be for us as a nation. Next slide. We look at our RT values. You remember this is the transmissibility numbers we talk about. You know, they're not bad, but they're not good enough. What they show is that we've bumped up a little bit, and there is some transmission in the community, the state, and in our zip code. So again, we want to be real careful. I will point out that in the university, where we have lots of students coming in, lots of faculty, lots of staff, we've done pretty well. We have controlled transmissibility significantly because of the policies, procedures, and protocols that are in place, including athletics, which has done a fantastic job when we bring our folks together. But yet we're not complacent. The numbers are decent for what we've been doing, but we have to bear down even more. Next slide. And if we look at our vaccination rates, you know, across the board, I'm most proud is that almost all our seniors are vaccinated. That is the most vulnerable population. The next would be people with chronic diseases, transplants, asthma, taking steroids, things like that, cancer treatment. And we're doing a pretty good job of getting to them as well. Overall, in our state, we're at about 60%, and that's about where we are as a nation. That's not a bad number, but I want you to look at it on the other side. That means that 40% of the population is still not vaccinated, which means we have 40% of people that are potential vectors out there spreading disease inadvertently. So vaccination, very important. Next slide. So if you have any questions, and I know there are many come up, I know the president, myself, the team, Holly, our dean, we get these questions all the time. We welcome your input. Call us if you're not sure about anything, about mitigation strategies, about getting vaccinated. Please call. That's why this information line and email is there, so we can get your questions answered in a timely fashion and give you the best scientific information in order for you to make the best decision for you and your family. Next slide. Thanks. So, Bobby, as we move along, I know since we brief you every day and have lots of discussions, I guess I want to project to the public here that we are still very concerned that we can't let our guard down, that the numbers are telling us not only in cases, but in staffing, nurse availability. Registry nurses are getting tired out, so we can't bring in the reserves to help us, that we're still not out of this and we've got to bear down. And one thing I think I would like to toss out to you, Bobby, because something I witnessed over the weekend and I got calls about at our football game and some of our other events, where our staff, some of them are students, are being abused by people who disagree with mitigation strategies or disagree with vaccination. You don't kill the messenger. These folks are actually an extension of our president, where we are doing the best we can within the legal guidelines that have been framed by our legislature and the governor to urge, inspire, and hope that everybody will adopt those mitigation strategies and get vaccinated. Don't take it out on the elevator operator. Don't take it out on the ticket holder. They are merely messengers carrying the message that the president has given us to all of you so we can keep our community safe. I would hope you could comment on that, Bob, because it really distresses me that these people who are merely doing their job are being abused.
Yeah, thanks for bringing that up, Rich. I have not seen firsthand as much, only isolated incidents, but I was always concerned as we move from the outdoor environment for the football games, indoors, we're going to be closer together. It's going to get colder. We're going to see Minnesota, number one, 67 new cases per 100,000. My concern has always been, it turns out we have some very good basketball teams. Our women just won against number 6 Louisville. They're going to be playing tonight. The men turn out to be pretty good. They're going to play on Tuesday night. And we're going to be in close quarters. And luckily, a lot of people like to come and see our basketball teams. And we want you to have that privilege to do that. But there are clearly public health guidelines that we want you to adhere to. You're going to be required to get in the building. You're going to have a mask. when you go to the restroom, when you go to get concessions, we expect you to have a mask on, and people are going to ask you nicely to do that. That is my expectation for everybody that comes in the building. Now, when you're sitting in your seat, you can watch me. I keep my mask on all the time. And I would want everyone to do that. I understand when you're at your seat, you may have a drink, you may have some popcorn, and you need to remove your mask. But I think for the most part, when people get in their seats, at least what I've observed, is that they take their mask off. Think of McHale as one big airplane. And we've seen how many flight attendants are being assaulted and abused, and people are getting arrested. It's a federal crime if you assault a flight attendant. We don't want that to happen in our big airplane that we're flying to success here. Please don't disrupt the activities at our events, because our players, our coaches put a lot of time in preparing for these games to provide each person who comes joy and entertainment. And we want to root for our players. But I want to be clear about what you said, Rich, that we will not, absolutely will not tolerate people being abusive to the individuals who are there to serve you by taking your ticket, to serve you with concessions, to keep you safe. And I'm really concerned about these reports of verbal assaults to our employees. As an employer, we need to, and we will come to the aid of our employees. One of the values of our university is compassion. And I would just ask everyone who loves this university and loves our sports teams and likes to come to celebrate, to have some compassion for their fellow human being who are there trying to serve you and not be abusive. It's just absolutely disgusting and will not be tolerated.
Bobby, thank you so much for reaffirming what we all know about you and your leadership. And I think that'll go a long way with having people, feel comfortable in the jobs that they've been assigned and following the policies that you've given to us, as well as the Board of Regents. Now, really, it's my privilege to introduce Dean Kendall Washington White. And maybe I want to embarrass her, because she has been just a force to be reckoned with. She has been one of the best partners we've had in our incident command system and across our university. And what I've come to see in her, she's not just a dean, she's like the mother for all these kids. I mean, she really, really cares about every one of these kids. And all of our comments and all of the meetings we've had, it's always about our students first. And she always comes up with good solutions for us to help us through very complex problems. So we're real fortunate that she had time to join us this morning. So Dean Kendall Washington White, thank you so much for being with us.
Thank you, Dr. Carmona, and thank you, President Robbins. I'm really happy to be a part of this session today. And, as Dr. Carmona shared, I'm always looking out for our students. And to the issue that you just raised about people upsetting and not playing right, with the people, because we have thousands of student employees on campus as well, and they've been the recipients of this kind of behavior as well. So I appreciate you both for bringing that issue up. I'm coming to you today from a space of well-being and compassionate. Compassion is my favorite value here at the university, because it requires us to think about how people are feeling, not just thinking about ourselves, but making sure that our students in particular, but also for our faculty and staff, to be able to do the work that we need to in order to be successful here. So again, well-being is what campus life is all about. And I want to make sure that we focus in a larger way. Mental health definitely is an issue. Conflict resolution, financial fortitude, basic skills that our students need to have in order to be successful here on campus. And I would say that I'm so proud of the departments in campus life because much of the work that each one of the departments do are doing things that are helping students to be successful. So your health is really important, whether it's physical or mental. Our campus rec center opened immediately when they could so that our students could have the opportunity to be fit and to be able to play sports and all kinds of things that happen in the rec centers. Our campus health department, we all know that they've done a Herculean work in the vaccines, but also our CAPS organization has done a great job with expanding mental health support for our students. And, you know, I think our students and the parents are really happy that we have these resources here on campus. Our Disability Resource Center has had a huge increase of people needing accommodations, and they've done it quickly, fairly, and important work for our students to be able to get things done. But I really want to talk much more about mental health because we all know that, as President Robbins said earlier, that we've all been impacted. And when we think about our students, when the pandemic initially hit, we had to send our students home. Not everybody could go home immediately. And they were isolated in the residence halls and on campus. It was not how we view the university, you know, the hustle and bustle of seeing students on campus. But, you know, it was a real struggle for all of us on campus, and mostly our students. I remember having a Zoom meeting with a student who had to move back home, and she had to share her bedroom with a little sister, and she had to, you know, help in her family, and she didn't have any space in her home where she could get her schoolwork done, and it's all online. And that was a really it was poignant for me in particular because I understand that some of our students don't have a space where they can be successful, right? So that helped me to understand even more about the isolation, not being able to hang out with their friends, not being able to see their faculty and academic advisors in person, even with the university opening and having Zoom, but people became Zoomed out, and I think all of us have, right? And so for our students, it's even more important that we have that in-person operations on campus, and I'm so happy that we're back. It's really important that when we talk about mental health, not everyone has a diagnosed, issue. Sometimes it's just basic skills. So if you're in a roommate situation, having the ability to work things out and not always call mom and dad to try to figure it out, but that we make sure that we do that. But I do think that our CAPS organization has done an outstanding job this year and last year with supporting our students. Our students know that we have mental health resources. We have embedded counselors in colleges. We have them in our cultural centers, and we have it in our North Rec Center and also in campus health. So students can have access to those resources at any time. Students can seek support 24 hours every single day of the week. And it's amazing that we have that resource. We have quite a bit of great resources for our students. And if you will, I will help you know what the data related to CAPS. During the 2021 school year, CAPS served just under 3,500 students, and 54% of them had never been to CAPS before. So that's demonstrating the need for us to have that resource on campus. This last year overall, we had over 18,000 students who visited our counseling center. The most frequently issue is anxiety, depression, and adjustment. So when you think about that, and again, students felt isolated. They didn't have opportunities to engage with other students on campus. Since the pandemic, the increase in students presenting with grief, isolation, decreased motivation, and increased anxiety about learning to re-socialize. So, when we think about this, our students, our freshman class that came in this year, they were in the same situation as we were. Our first year students from last year here at the U of A, they didn't have that year of being a true freshman. And so they're all having to re-enter. And even though it feels like we should be over it, but it's going to take some time for us to get back to normal. So I just wanted to make sure that we let everyone know that we have significant resources for our students. And what we want from parents and from students and for our faculty and staff is to make sure that we are demonstrating compassion and making sure that we take the extra step to help students to get the support that they need. And I think sometimes students don't want to use our university resources, and that's okay, as long as they are using resources off campus. But I would like for them to be here on campus and getting that support. So, I would love to take any questions from you, but I really want everyone to know that campus life is really the embodiment of compassion for our students on campus. So please, if you have any students that you are concerned about, let us know. You can start with the Dean of Students office and we can make sure that our students get the support they need.
Thank you, Kendall, and thank you for all you do. 25/8, not 24/7, 25/8. I know your job is tough, but like Rich said, we know that you're the person who looks out after all of our students, and there've been some very difficult situations over the past couple of weeks around mental health issues, and you're on the front line every day. So I just, many thanks to you and your team for all that you do in your leadership. This issue of isolationism and especially stress around the holidays is really important. It happens, it even happened before the pandemic. The pandemic has just amplified it and made it more difficult. So I do want to ask that if students think that they're feeling isolated, lonely, hopeless, depressed, overwhelmed, finals are going to be coming, please reach out to us. Reach out to us individually and use the system that we have in place, because we will get to the other side of this. We keep thinking we're, quote, as you said, over this. We're not going to be over this entire academic year. And I would say that the epidemiologists would tell you it's going to take a couple of years to get past this. The 784,000 souls have died from this, and there are more deaths coming every night. When we look on this, there are 3, 4, 5, 6, 7 people in Southern Arizona continuing to die from COVID-19. And each one of us can give a testimonial about people who are close to us who've died. So we've got to remain vigilant. We've got to do all of the things we keep talking about in terms of mitigation around the physical and medical side of things. I know people don't always agree with us on that, and they have the right to disagree, but in a civil way, we're just not going to tolerate our employees being verbally abused, and we can talk more about that. But this mental health issue is one that is really distressing, and everybody's felt it. So thank you for being here today, Kendall, and thank you for what you do other than this hour, every hour of every day.
And President Robbins, can I share that there's good news too on campus as well. And, you know, in particular, I think about the College of Fine Arts and the swings that we had was a hit, right, for our campus. And the more events like that, the better we will all be. And I think that will help our students as well.
Yeah, and I think there was great joy of having a commencement ceremony on the steps of Old Main on the mall and giving those 2020 graduates a chance to come back. You know, there were over 1,000 who came back, and it was just a joyous occasion. And I agree with you with the swings. When I found out they were only temporary, I was very sad because I got to go out and swing. It reminded me of swinging on the front porch when I was a kid with my grandmother. But I hear they're coming back. I would like to push for them to be out there permanently. But we'll get to that, you know, as time goes on. But it's the small things, and it's taking time to interact with people. And I keep coming back to that core value of compassion. You know, we're one of the few universities that has compassion as part of our core values. And I am really proud of us for adopting that as one of the core values.
I think we're going to have seesaws the next time.
Well, I think, you know, I think that to what both of you are saying, that these events really are the antidote to the isolationism, you know, to getting us together. You know, when we're humans, we take for granted, but we require that intimate touch, that high five, a hug, you know, just being among other people, exchanging information. And these events really serve that purpose to try and defeat the isolationism that actually fuels the depression and that whole arc of mental health challenges that we see before us. So thank you, Dean, for all the work you're doing to take care of all of us.
Yeah, Kendall, thanks for reminding us that there's a lot of positivity going on. I say all the time, we've not only survived, we've thrived. There's so many positive things going on at this university that it makes me so proud and humbled to be a part of it. The one thing that was hanging out there that was still, we couldn't quite get over the hump on was winning a football game. And so we even did that. And there's so much to be happy about, to have joy about. But there's the reality that we are not out of this pandemic. And there are going to be many people who are going to be sick. There are going to be people who are going to die. And we would be irresponsible if we didn't stay on our message of, you know, the same thing we've been saying since the start. Cover your face. This is an easy thing to do. It's an easy thing to do. I know it's a pain and it's not comfortable sometimes and it's kind of difficult to breathe, but it's easy. Just put it on. I guess I'm jaded. I used to live my whole life with one of these on, standing on my feet, and Rich did too. So that one's easy. Clean your hands. That one should be easy. Try to stay as far away as you can from as many people as possible. And the most important thing you can do is get vaccinated. I mean, we will stay on this mantra, and it's important, and important messages for us to deliver and remain steadfast with.
Before we go to questions, I think we wanted to just talk about one more issue here, the availability of the holiday meals. So if you guys want to bring up that slide, Dean White, do you want to go through this?
Sure. Last year, we actually, the university's student union has always had dinners for students, but for this year, it's going to be a Thanksgiving grab and go dinner for students who may not be able to go home. So you can see on the slide that on Wednesday, November 24th, the student union is going to have grab and go dinners for students, and make sure that you get a reservation so that you can definitely have a meal for Thanksgiving. And it's free.
Everybody likes something free. And yeah, and that URL is live now. And so anybody who would like to order that, I think there's a deadline of early next week, but all the information is on that website. So please go there and grab a meal and feed yourself and be as thankful as you can for us. And that's all I got. You ready for questions now?
Yeah, I think let's go for questions. I hear we've got a lot of people waiting to ask us questions. We're eager to engage with them.
You got it. Your first question comes from Bud Foster from KOLD. Go ahead, Bud.
Yes, I watched the basketball games. First of all, good morning. I watched the basketball games on television, and when the cameras pan the crowds, you can see that there are a few people wearing masks, but many people do not. You have a mask around the neck, and you have many standing in the front without a mask at all. How can you enforce this? Should you enforce the wearing of masks? You require them to bring a mask to the basketball game. What about requiring them to wear the mask during the basketball game?
Yeah, Bud, thanks for your question. I sit and survey the crowd. First of all, you got to put it on to get in the door. I think in my previous comments, I've said, I think it's a good idea. I practice it by trying to keep my face covered as much of the time as possible everywhere I go. But when people are in their seats, those, and I would say, I don't know, as I scan, it's probably about 20% of people. Maybe that's too high, but keep their face covered the entire time. That's what I'd love to see. Again, drawing the analogy that McHale is like a big airplane flying, whatever it is, 10,000, 15,000 people together. We're close together in there. The football stadium's a little bit different because it's outdoor, and we know that it's not as dangerous. So the premise is that we strongly encourage and require you to have a mask coming in, and we would like for you to keep your face covered the whole time. When you get into the enforcement of it, that means that we would have to, just like on an airline, go to each person. So now we're talking about, let's just say it's 10,000 person crowd. And my, observation is that, 20% we don't have to deal with. That means we got 8,000 people that we've got to go to and ask them to put their mask on throughout the entire game. And it's going to disrupt things. We know that. And it's very difficult for us to enforce at that scale. Now, when they're in the restrooms and the congregating around the concession stands, it's a little easier for us to ask them to just cover their face. So I think that we're going to have to step it up and try to encourage, educate people to be more compliant with this. But I don't foresee that we're going to go row by row, seat by seat, like would be on an airline, and tell people if they don't comply, we're going to usher them out of the game. I don't think we're to that point, but we clearly are taking this seriously and are trying to encourage people to help us be good public health ambassadors.
All right. Your next question comes from Craig Smith from KGUN 9. Good morning, Craig.
Hi, good morning. I guess this would be for Dr. Robbins. If the case rates continue to climb and perhaps the holiday travel aggravates it still further, do you foresee at least possibility of going back to more virtual instruction if you have to?
Yeah, I think, Craig, all options are on the table always. The one thing that I've looked at is that the number of students who've been in our isolation dorms, those compared to last year, we had several hundred at a time at one point. Now, of course, that was before we had the vaccine. But I think as long as we don't see overwhelming our system in the isolation dorm, and the ability, if someone were to get really sick, to go over to one of our local hospitals, that will continue to move forward in the current face-to-face situation that we have for instruction and learning. But we watch this every day, and I would say that, Dr. Cullen and the health department, we're in constant contact with them about issues around public health. So we're not quite there yet, but the trend is not going in the right direction. That RT value of 1.56 in the 85719 zip code, that's got me concerned. We've got continue to do surveillance with wastewater-based epidemiology, and we're continuing to test. I think that testing is really, really important, because even if you've been vaccinated, even if you get a booster, you can still have a breakthrough infection and spread it to others. And then there's the whole issue of those people who have chosen not to be vaccinated. So as of right now, Craig, I think we will try to finish out this semester. We'll obviously start back, or planning to start back in face-to-face mode in January, but we'll keep an eye on things. And if things don't go the right way early in the next semester, we'll always have the option to go back to a more virtual delivery. None of us wants that. None of us wants that. So we will keep an eye on things and try to make the best judgment of balancing the issue of continued spread of this deadly disease with the engagement and mental health aspects of our students.
Yeah. Hey, I just want to add, Bobby, for situational awareness for Craig and others, is that in order for the president to make the most timely decisions on any of these issues, the incident command system provides him with a very comprehensive briefing every 24 hours. That includes the campus situation, the city situation, the county situation, the state situation, and the national situation, to include things that we don't often talk about here, but how many beds are available in our community? How many ventilators are available in our community? In addition, working with the public health department and the county, being able to assess just how much surge capacity we have at any time. Because one of the things we started from day one is we recognize that if something bad happens and we see a lot of transmissibility that even overwhelms our isolation dorms that we have prepared that need a higher level of care, we have to depend on the community. So we're very carefully watching staffing, bed availability, speaking to hospitals, speaking to the health department, so that every 24 hours, good decisions can be made, because the president has the most relevant information through our incident command system.
Fantastic. Thank you, Dr. Carmona. The next question comes from Andrew Oxford from Arizona Public Media. Go ahead, Andrew.
Hi, good morning, everyone. I wanted to ask, and I see Catherine's asked a similar question in the chat, but mine's slightly different. One is maybe I missed it, but can you go over the vaccination rate for employees at the University of Arizona? And can you also address what policies the university is putting in place or is considering for employees who are not vaccinated and do not receive an exemption by the December 8th deadline?
Yeah, I think we're at about 75 odd percent of our total employees, which includes student employees. The fact is the students are at a higher rate than the non-students, but overall we're at about 75, 77%. The deadline has moved for this federal requirement for contractors. And just to be clear about it, because we have federal contracts and grants and awards for primarily our research operation, which is a really important part of our university in the discovery and translation of those discoveries to make the world a better place. We have to comply with this requirement that our employees be vaccinated by a certain date. We went through the accommodations, and you're asking about those people that are, let's say it's 20% of our workforce who have not yet been vaccinated or may choose not to be vaccinated. That deadline has extended into January, and I think we'll continue our efforts to educate and reach out to each one of our employees who've not yet gotten vaccinated or may choose to never get vaccinated, to have a discussion with them about, what we can do to help them through this, because clearly we don't want to have anyone have to be put on a paid leave of absence just because they don't take the vaccine. So we're working, especially with this group of about 20% of employees, to make it easy for them to get a vaccine, to understand the reasons if they choose not to. Could they get accommodation through the two ways, either through our Disabilities Resource Center or through our Human Resources Department? And we're going to work with everyone, because we want everyone to be protected, but we want everyone to be working as well, because we need you. We need you at the university, and I think we will get it down to a small number of people that we'll have to address this issue with. By now, I think it's January 18th. The deadline's been moved to then. So we've got another couple of months to work on this. We've gone in just I don't remember when we put this in place, maybe 3 weeks ago, maybe it's a month, but we've gone to from 51% up to 77%. And I think we'll get it up to, near full compliance.
The next question comes from Catherine Palmer from the Arizona Daily Star, and it's relatively the same. So I just want to make sure, I think you answered this, President Robbins, but I want to make sure we ask it. And she says, since issuing the employees vaccine mandates, what percentage of employees have uploaded their vaccines, which you've answered? And do you have some concerns that some employees won't meet the deadline?
Yeah, I do. I think, all universities, all employers, they're facing this issue. I mean, there is clearly employees that just don't agree with getting the vaccine. I mean, they're no matter how much education or how much discussion we have, they're just going to choose not to do it. I think people have the right, obviously, they can research, discuss, and it's their body. I do not want to hold someone down and force a needle into their arm. They've got the right to to not do that, to not take it into their body. So is there a way that we can have a conversation with that each individual who makes that choice to talk about, could we make accommodation for where they are in their mind? There are going to be some people who just going to say, I'm not going through the accommodation phase. I'm just not going to do it. And either you fire me or let me work. And we're not going to be able to allow those individuals to continue to work if they don't go through the process. So I want to encourage everyone to at least have a discussion with us and let's work this out. I mean, we've seen a lot of the sports stars that we read about who've chosen not to do it. And unfortunately for some of them, they live in places where they can't play. And it's a sad thing to watch, but they have the right to choose what they put into their body or let someone else put into their body. And I respect that.
You got a few more questions. And I think this one probably, Kendall, you can go first, followed by President Robbins in this. It comes from Alexandra Perry with the Tucson Local Media. And she says, I've gotten several messages from U of A students that are concerned about the Charlie Kirk event tonight. Can you tell us the rationale behind hosting Charlie Kirk on campus? And will this be a masked event?
Thank you for that question. The University of Arizona is a public institution, and so any group can come on our campus, whether they are scheduling a space on campus or they may want to protest something on campus. So as long as those individuals are not disruptive, violating any of our policies and procedures, they have a right to be there. So we can't say no because of people's ideology or whatever it is that they're talking about or wanting to get people to understand. We can't do that. We have to allow for this to happen on campus. And trust me, as the Dean of Students, we get these kinds of issues on a regular, it happens all the time. And our role is to monitor, to make sure that there's no disruptive to our campus. And also for our faculty, staff, and students, that we have to do more work with helping people to understand why the university allows us to make these issues happen on campus. So it's important that we do the right thing by the First Amendment, but making sure that we are not causing any harm to anyone.
Yeah, I don't have anything to add. I mean, I'm in my 5th year here. Kendall's been here a lot longer than me. She's taught me a lot about how things work. And I just absolutely agree with everything she just said. And there should be space for people to have open dialogue about their differences, and clearly there are going to be differences. All I know is I'm going to be at McHale tonight to watch the women's basketball team hoist that banner for coming one shot away from being a national champion. And I tell you, after watching them against Louisville, don't count them out this year. I know we lost Ari McDonald, truly a generational player. I think they've gotten deeper, certainly, and stronger. You can't replace Ari, come on. But I think they're a very, very good team. And I'll be at McHale tonight watching Coach Barnes lead our team.
Going back to that, just to circle back to Alexandra's original question, I also believe, according to those flyers, that this event isn't actually being held on the University of Arizona campus. It's being held at the Marriott just off of campus. And so we will have people there to observe for our students, but it's not being physically hosted here on campus. The next question comes from Luke Forstner from Qatar, and he says a new poll by ABC News and Washington Post found little over half of parents are not confident in the safety or effectiveness of the coronavirus vaccines for kids. But numbers show that people are much more trusting of the vaccine for adults. How do you suggest fighting this perception of the vaccine as less safe for children? And do these numbers match what you've seen in Arizona?
Well, I think I'm going to probably have Rich comment on that, but I'll just say they're your children. The science is good. These vaccines are effective. They're safe. And don't fool around with subjecting your child to getting an infection and ending up in the hospital and having the story, I wish I'd have gotten the vaccine for my child. I mean, I understand the data and the research, and I'll let Rich comment more eloquently than I am, but I come back to the point of, when Rich and I were kids and, we just went down and got our sugar cube, or some people got shots. Otherwise, have we not done that? There were plenty of people you could go and see, not just on ECMO, but in an iron lung. So I don't know. I think we're going to get there eventually. I just wish there were a day where everybody would just say, you know what, we're going to go to school. We're going to go to our place of worship or our place of gathering. We're going to go to an athletic event. We're just going to roll up our sleeves and we're going to just move on. Get vaccinated and let's get beyond this. But that day's not coming. And so we've got to figure out how to maneuver through this continued vaccine hesitancy part of our country. Rich.
Thank you. Thank you, Bobby. And clearly, I cannot speak any more eloquently or passionately than you do on this subject. I mean, because both of us come to it not only as physicians, but as parents. And, there's nothing more important to us that our greatest asset are our children. And so I'm dealing with this also, as you know, at a national level and at the state level with the governor, and trying to defeat some of the conspiracy theories and the hesitancy. Some of it, we realize we can make a difference because people are fearful. They don't know. They're not sure that it happened too fast. Has appropriate research been done? We can answer all of those questions. But then there are people that are just well-entrenched individuals who say, you can't tell me what to do. And I would say to our audience, over the years, I've been involved in all of these issues. And as Surgeon General of the United States, what you come to really realize is what I would call the perils of democracy. It is often an issue that becomes contentious is the right of the individual versus the collective right of society. We saw it with smoking, for instance, which is a simple one. You're an American, you can't smoke, but your smoke hurts other people, okay? And it costs us all because you choose to smoke. Those are things that we struggle with in a democracy as to how to make the right decisions that are for the collective good, but yet not tread on the rights of the individual. Here we are with vaccines, it's the same thing. I don't want you to tell me that, and for a whole host of reasons. So we look very critically at the demographics and see what messages will resonate with which groups. The people that are concerned about not trusting the government, the minority population, people who have less health literacy and don't understand. These are people we can reach, and we work hard to reach them in the broader community, not just the university. But then there are those that are well entrenched. But you said it perfectly. Vaccines are efficacious and they are safe. And I would argue that vaccines are probably the greatest advancement in the history of science as it relates to mankind. Because think about populations that were decimated in the past. Think about, as you pointed out, Bobby, all of the polio that was prevented in the 50s and 60s, when our parents were afraid to send us to school because of the pictures of children with iron lungs. Think about measles, mumps, rubella, whooping cough, tetanus. We don't see those diseases anymore in vaccinated populations. And when we look at COVID, if you're vaccinated, very unlikely you're going to get the disease. But if you do, it's generally a mild case, and it prevents death and being on a ventilator. So I take it very personally as a parent and a grandparent, when people tell me, yeah, I want to wait it out. But what you're doing is rolling the dice and saying, I think my kid will be okay. Well, there are hundreds of other parents that did that and now struggle that they didn't make the right decision because their child ends up in an ICU, on a ventilator, and even worse, death. It can happen because we don't know exactly how to say, oh, these are the kids that would be more at risk. So to your point, Bobby, it is really, really important, not only for protecting your children, but protecting your community and getting us out of this ongoing war with this invisible threat that everybody who can get vaccinated should get vaccinated. And I think that's the message we have to clearly send to everybody. For our children, for our adults, for our at-risk population, we have a long history of vaccination, well over a half a century, of how successful it is. And what happens when you don't vaccinate and it decimates populations. Let's do the smart thing now. Get vaccinated.
A follow-up to that from Luke is, according to a study by the Arizona Public Health Association, Arizona is the only state in the country where COVID-19 has been the #1 cause of death since the start of the pandemic. Why Arizona?
Wow, that's a surprising statistic to me because while COVID is going on, there are people dying every day from cardiovascular disease, cancer, neurological diseases, accidents. So I'll take it at face value, but I'll ask Rich to comment on how that could be possible. Maybe it's because we have an older population. We're not as vaccinated. I'm not sure.
Bobby, I think I struggle with it too, but I think in general, we have to look at the demographics, the older population. We have to look at the fact that we have the largest Native American population that are in far off geographic lands with the paucity of support systems. And in fact, they are health disparate to begin with. They start out with more obesity, more type 2 diabetes, less education, and so on. So they are more vulnerable population. So, it's a great soundbite, but when you actually drill down, you can see why that might be apparent. But whether we're 1 or 10, the bottom line is we got to get vaccinated. We have done, the university, our community, our public health department have worked tirelessly this last year and a half when vaccines became available, putting vaccines on vans and sending them out to the most remote areas, engaging the migrant workers, who often are forgotten. But yet we can argue today that those migrant workers picking our food, they are essential because if they don't work, if they get sick, we don't eat. So the whole idea of essential worker has now evolved to the truck driver who drives your vaccines to the clinic. If they get sick and don't drive the truck, they're pretty essential. So we've had to rethink all of this. So the soundbite is an important one. It tells us there's more work to do. We've identified those high-risk populations in Arizona, especially the underserved, people of color. These are things that some of my colleagues and I wrote about early on in the pandemic, when we started to see that the people of color were disproportionately affected by that. Ties into the social determinants of health. So this is a multifactorial answer to a complex issue, but bottom line is practice your mitigation strategy, get vaccinated as quick as you can, and that will help to make all of that go away.
We have a couple follow-ups. The first one from Bud Foster. Go ahead, Bud.
Yes, Dr. Carmona, you and I'm sorry, can you hear me?
Oh, yeah.
Yes, sir. We hear you, Bud.
You both talked about abuse of employees, and it's something that you won't tolerate. Can you give me some examples of the abuse that you're talking about? What has happened to have both of you bring this up during this press conference?
Yeah, I think, Bud, just people verbally abusing, assaulting. Rich and I talked about this earlier, really assaulting people who are just there to try to serve the patrons who come in to observe these athletic events. I've not seen that personally, because if I see it, then I'm gonna do something about it immediately. But I have seen this attitude of not wanting to comply and having their opinion known that they don't agree with it, but they're going to go along with it and put their mask on. But when it turns to, I think you've seen the videos of people on airplanes assaulting flight attendants, physically hitting them. We don't want this to happen at our university, and not even the verbal abuse and the disrespect. All I'm asking people to do is have a little compassion for your fellow human being, and don't take it, come see me, come talk to me. Don't talk to the person that's in the arena just trying to do their job. I'm there at the games. I am accessible to you. If you want to come talk to me, come talk to me, and we'll have a discussion about the behavior that you're exhibiting and that we're just not going to tolerate.
But just quickly, I've had a number of the reports. I haven't seen it myself, but then speaking with the president last night and this morning, we decided it was important enough that we wanted to reaffirm to our students, staff, faculty, all of those who are working to support us that we will not tolerate that kind of behavior. They deserve to know that we are firmly behind them. And it's no problem. People want to express their beliefs and they say they don't want to, that's fine. But don't take it out on that worker who's simply doing their job.
Yeah, and I think, Holly, you said you saw people spitting on employees at the Cardinals game. I just not seen that from our patrons here, our fans. I don't know. I just we do not want to have this pattern of behavior grow. We want to nip this in the bud and just put a firm line down. We're just not going to tolerate this.
Right.
And we have time for one more question, and that is a follow-up from Craig Smith at Kagan.
Thank you so much, but I'm okay. No, thank you.
Well, hey, thanks, Craig. All right. Any last words? And thanks again, Dean Kendall Washington White, for joining us today. I think your message is incredibly important. You and I had lots of discussions about that this weekend. So thank you very, very much for joining us.
Thank you.
Yeah, Kendall, thank you for all you do. Rich, thank you for being here. Holly, just the usual parting message, one that is even more poignant during this holiday season. Please perform random acts of kindness, compassion for your fellow human who are here in this world. We're all in this together. So with that, I would just encourage you, wash your hands, stay as far away from as many people as possible, mask up, vax up, and as always, bear down. We'll see you out there. Be safe.
Good morning, everyone. My name is Terry Hunt, and I am the Dean of the University of Arizona Honors College. I would like to begin our program by respectfully acknowledging that the University of Arizona is on the land and territories of indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being the home of the O'odham and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and indigenous communities through education, educational offerings, partnerships, and community service. On behalf of the Honors College faculty and staff, it is my great pleasure to welcome all of you today, whether you're attending here in person or viewing on our live stream, to the Honors College Family Weekend Celebration. This event is an opportunity to recognize our new students and reconnect with those Honors Wildcats who've been with us for the past few years. And being able to do that with our students' families who are present with us now, especially after not being able to gather together for about 18 months. Really pleased to be here together with you. This event is also an opportunity to talk with you about the future of the Honors College. We have some announcements to share that will have long-lasting and far-reaching impact on all of our students, both current and future. But more on that in a few minutes. I would like to recognize some of our University of Arizona leaders who have joined us today. With us, we have University of Arizona President, Dr. Robert C. Robbins. Welcome. University of Arizona Provost, Dr. Lisa Polk. Dean of College of Humanities, Dr. Alain Philippe Duran. Dean of the College of Veterinary Sciences, Dr. Julie Funk. I thought that went dead, yes. And from the College of Law, Dean Mark Miller. And Dean of Undergraduate Admissions, Dr. Casey Irkirdes. Thank you all for joining our celebration today. I would now like to welcome our new honors students in attendance, new first-year or transfer students to the Honors College. If you choose, please wave or stand to be recognized by your peers, family, faculty, and staff. Welcome. And since we were unable to hold this event last year, I would also like to ask any students who joined the Honors College in the fall of 2020 or the spring of 2021 to wave or stand for an overdue welcome. To all of our new students, welcome. We are so pleased to have you join the Honors College family, and we look forward to seeing your many accomplishments over the next few years. And to our current students, we know that the last 2 years haven't been what we've all anticipated. You've faced many challenges and obstacles, but you have persevered. You've not only persevered, you've continued to achieve great things, even in the midst of great uncertainty. I think that all of our Honors College students deserve a big round of applause. When I came to the University of Arizona 4 years ago to become dean, I knew that the Honors College had a long history of helping students to grow intellectually and academically.